everyone. I'm Megan Cullip, along here with Scott Michlin.
Good morning. Here we are, Thursday, May 13th, right?
Yes.
Yes.
I can check my watch. Yes.
Check your watch. Okay, there you go. Week
61.
Really?
Yeah.
Oh gosh.
I'm pretty
sure.
I'm pretty confident.
There you go. Confirmed by the internets.
Yeah, I thought you were going to break down over there for a second.
Are
you sure?
It's okay. Yeah, well, it's
getting long.
It is, but here we are. Well, and we have committed to be here as long as we need to be here.
That's right.
So that's why we're still here.
That's right.
Because we still need to be here.
That's right.
And even in week 61. But there is good news and, positive news to share as we talk about vaccines and vaccination rates and some of those other things that we'll be sharing today. But we do have a great show and some great guests lined up. Let's take a look at the lineup. Look at that all-star lineup.
It really is an all-star lineup.
Right. Dr. Preston Herrington, local pediatrician, talking about COVID vaccines in children, which we just were talking about earlier before we came on the air that, the CDC, I believe, is allowing some emergency use for now 12 to 15-year-olds, and probably more to come. And so what that all means, and, for parents who maybe have concerns, Dr. Harrington's going to be here. Matt Bieber from the Department of Health talking about the vaccine rollouts, again, throughout New Mexico. It's, the vaccines are being made available in more places, more locations. And so, of course, as the state looks at that 60% full vaccination rate of New Mexico to hopefully then reopen a lot of things, get rid of those color-coded restrictions and things along that line. And then we have Natalie Spruell from the City of Farmington Parks, Recreation, Cultural Affairs Department.
Yeah, we haven't seen her since she was showing us all sorts of at-home exercises.
I know, right? And so she's going to be back to talk a little bit about some of the city's plans for summer recreation, children's programs, things like that. So for parents who are maybe thinking about what kids will be allowed to do, might be allowed to do.
Yeah.
The city's working on
Where
that.
are we going to put these kids?
Right. So lots of things to talk about. So that's what's going on. So lots of good information to share.
That's right.
Right. So should we start with our first guest?
Sure.
Who I think is already on the phone this morning. So let me get him on the phone. Good morning. You're on KSJE. Thank you for calling in this morning.
Hi. Good morning.
Dr. Herrington, good to talk to you.
Yes. This is different. No, I don't have to wear a tie this morning. I'm not on video.
That's right. We didn't have you on Zoom today, but we got you on the phone. So thank you for joining us.
Sure. Happy to be here.
And we assume you're at least wearing something.
Oh, gosh. More than just the white coat, I hope.
There you are.
Goodness.
Yeah.
There you are. We have a picture of you in a green shirt, so that's how I'm picturing you, Dr. Harrington, right now. There you go.
Good. That works, yeah.
Thank you, sir. But we wanted to get you on the program to talk about the news about the vaccine, the COVID vaccine, and being authorized for use, at least one of them, right, with younger folks, now children 12 to 15, correct?
That's right. Yeah, that was the news this week, that the FDA on Monday and then the CDC came along yesterday, giving the green light to go down to age 12, whereas it used to be that the Pfizer vaccine you could go as young as 16. So that's good news. We're pushing it closer to the younger ages.
Great. And so can you talk to us a bit about the difference between this partial and full approval? Is this in the full approval stage? Does that take 6 months? I'm a little confused myself there. So can you speak to that?
I'm not really an expert on the details. That's a good thing. You're correct. So far, all of these vaccines are still under what they call an EUA, Emergency Use Authorization, and I don't know what it takes for the timeline for them to become fully approved. I think it should be coming soon for the adults, and so I don't know what goes on in the FDA to move somebody from EUA to full approval. I know the company has to request that it be approved, and I don't know where they are. There's the other two vaccines as well as Pfizer that are approved for adults, and they've all had plenty of, they've been given to millions of people. So I don't really know what the timeline is for that. But you're correct. Right now, so far, everything's under an EUA.
Very good. And I think I heard, Dr. Harrington, that Pfizer had requested maybe that other just regular authorization from the CDC for adults, as you mentioned. But with children now, are you getting questions maybe from some of the parents of your patients of, what to what to think about the vaccine, and of course, I think a lot of the advice has been if parents are concerned about even themselves getting the vaccine, the place to go for information is to their medical professional and to ask them, what their thoughts are. Correct?
Right. Yeah, that's always sort of the best idea, because your doctor or provider knows you better than anybody else does. But I don't really know any physicians who are giving anything other than a thumbs up for vaccinating against COVID in the context of the alternative being unvaccinated and being at risk for a real severe illness. And so I'm even stepping out. Like, I had a family yesterday where the kid was 15, and so he's not eligible yet, but I asked the parents, why haven't you gotten it? Well, we're kind of scared. And so we talked a little bit about how the vaccine is not scary, the disease is scary. And so I don't know any adult providers who disagree with that. So I think within the medical community there's not much controversy about the vaccine being a very good idea.
Right, true. And I do want to make one clarification. I think FDA is who approves these vaccines for use, correct? Not the CDC. I misspoke, and we don't want to do that and share incorrect information. Pardon me.
Yeah, typically it's both. So like the FDA gives approval, and then the CDC will give recommendations that it be given. And so I don't know of an example where they don't agree, but so typically they will, like before they're given in New Mexico, for example, and of course there was only a 2-day difference between the two, but you're right. Technically, the FDA is who gives what they call the approval, and then the CDC they have recommendations, as does like the Academy of Pediatrics, the Academy of Family Medicine, and they, for the most part, they'll all line up when it comes to vaccines.
Right. And so I have a question about, so it was 16 plus, it was approved for that age group. Now it's 12 to 15. What is the logic there? Are we eventually going to keep ratcheting down the ages so that it becomes like, mumps, rubella age kiddos, or how does that work?
I think so. My understanding is that they are already doing studies on kids as young as 2, and so I think the expectation is in a few months they will have data that it's safe and effective. My guess is the next sort of obvious cutoff is 5 to 11, because that would then include all school-age kids, and then the final step might be 2 to 5. And I don't, I guess we'll see how it goes, whether below 2 also comes at some point, or whether the data just supports. By that time, we may have enough herd immunity that kids under 2 aren't a concern. But yeah, so because it's kids, we're sort of cautious and making sure you do studies to show that it's safe and effective, and then you just kind of work your way down. But yes, I would say I heard a podcast this morning that they were predicting maybe by the end of this year or the start of next year that they might be talking about 5 to 11.
Interesting. And I guess the delay, Dr. Herrington, would be just in the normal testing of new vaccines, as we saw, right? And I guess the priority was to get the vaccine out to the elderly and adults, which is why it was made available first, and those were the groups that had the first tests and the first trials, and then it moved into the younger children, and that's kind of what we're seeing, and that's really the reason for the different time periods of when it's been released for emergency use with these different age groups.
Yeah, I think in my mind there's 2 factors that both line up. One of them is that the older you are, the higher your risk of severe disease. So unlike some diseases that affect kids worse than, say, 50-year-olds, the real risk of people being very sick and dying goes up a lot with each decade of age, so it made sense to focus on that. And then I think also as a society, with almost anything, if there's a new medication that comes out, you won't see it being initially given to kids. So I think as a society, we're more willing to tolerate if you're going to have, quote, guinea pigs, that they be adults, and then once you have a good safety profile with adults, you say, well, okay, now let's take a look. If it was causing awful side effects in adults, then that would probably be enough to say, well, then we're not going to give it to the kids until we get a better product that doesn't have as many side effects. So it seems to be the natural progression, and in this case it made sense because the younger you are, your odds of getting severely ill go down. Now, it's not zero, and we do need herd immunity, so I think that's why the timing is appropriate now that we've all of the adults who want it, and basically the supply is catching up, so the timing is just right now to say, okay, now let's start giving it to the younger kids, whereas that wasn't really a priority 6 months ago.
Very good. And have you heard anything about schools requiring these vaccines? I mean, they require other vaccines with some few exceptions. Have you heard anything about that regarding this one? Is that coming later?
I wonder, what I have heard is that some colleges are requiring it, which makes sense because, today, if you're college age, you can get it. I think it's too soon. It'll probably go state by state, so it may be that some states at some point say, well, just like when you're 11 years old, you need to have a Tdap, a tetanus, diphtheria, pertussis, that it wouldn't surprise me if they say, well, when you turn 11, you need to get the COVID booster in a few years. One thing is it's a little hard to require something if it's still only an EUA and it's not FDA even fully approved. So I think once you start having approval, then more employers and schools and public situations then will be on less thin ice to require, sort of legally to require something that's not even fully FDA approved. I think has some people a little hesitant. So, but if I was a betting person, I would bet that in 5 years that it is required for older kids. Wouldn't surprise me at all.
Gotcha. Interesting. And Dr. Herrington, I wanted to ask you too, a little bit about what we're seeing in children. And again, you mentioned that so far, children have not been as mostly affected by COVID as older adults and seniors, of course. But there have been cases, correct? And there even have been cases locally, I believe, in younger people. And so it's something that, again, as we learn more about this virus, right, and this infection, it is something that everyone really needs to be paying attention to, isn't it?
Yes, I agree. And initially, we were thankful that it was very rare among kids. That was a blessing. But as more and more millions of people have gotten it, there's something like a few tens of thousands of kids that have ended up in the hospital with it. And last I heard, over 300 kids had died from it. So that's worse than the flu, for example. There's also this other complication that is kind of after the infection is going away, the body kind of has an overreactive reaction to it, and it's called this multi-system inflammatory syndrome of childhood, where they get fevers and sometimes go into shock and have seizures and stuff. And there's been about over 3,000 cases of that. So that's correct. It's not that we're just vaccinating the kids for the sake of not spreading it to the rest of us more mature people, but it is actually, although it's rare, it can be a problem for kids as well.
Very good. Well, Dr. Herrington, thank you so much, as always, for joining us and giving of your time and expertise.
Well, it's always a pleasure. Nice talking to you guys.
Thank you so much. That's Dr. Preston Herrington from San Juan Health Partners Pediatrics joining us this morning here on KSJE. Good information. And again, that emergency use authorization is expected, I think, later today.
Well, I think it's already happened, at least according to Walgreens that sent me an email this morning.
Did they?
It said 12 plus, now allowed. So
there you go. Okay. Excellent. Well, very good. Well, let's go to our next guest, who is standing by as well. And hold on, I'm going to put Dr. Herrington back on hold if he wants to stay on the line. And we'll get our next guest on the line, Matt Bieber from the New Mexico Department of Health. Good morning. Thank you for joining us yet again. We appreciate it.
Hey, Scott, how you doing?
I am good, thank you. And I bet you would probably know, Matt Bieber, about this emergency use authorization for the Pfizer vaccine with younger people, children 12 to 15. Has that gone through, or is it expected later on today?
It has gone through. It's live.
Well, Megan, you're right.
Thank you, Walgreens.
She's gonna loop that.
Yeah.
Of me saying that she's right.
Yeah.
And play that over and over again.
That's the plan.
That's how it's going to go. But anyway, Matt Bieber from the Department of Health, we're glad to have you with us again to give us an update. I think we were showing, or I wanted to show, where San Juan County is in the vaccination rates from across the state, of course, as we work towards getting to that magical 60%. And so let me get to that really quick, everybody, to talk a little bit about that. And so we are kind of in the dark green in vaccinations, as we can see here, especially in the northwest corner. We're showing the vaccination map from the state dashboard, Matt Bieber. And then San Juan County, according to this, percentage of residents with at least one shot, 68.5%, and the percent of residents fully vaccinated here in San Juan County, 55%. That's pretty good news, I would think.
Yeah, those are good numbers. We certainly like to see numbers that are higher than the statewide average, and are encouraging counties to try to meet that average and climb past it, and trying to provide them every bit of support we can to hit those numbers. Right.
And so the state has been working, I think, to get the vaccine available to anyone who really wants it, at least 16 plus and now 12 plus, and getting it out to maybe more drugstore pharmacies and things along that line, as opposed to just Department of Health vaccine clinics that have been set up across the state, and that's been kind of the push recently.
Yeah, the couple of things are happening. We're doing a lot more with our mobile teams, so increasing the number of mobile team events around the state, including in the Northwest. And we're also beginning to solicit requests for on-site vaccination events from businesses and nonprofits and churches and community centers, really anybody that wants to put together an event at their location and bring their employees or their members or family members or community members from nearby. We're happy to support that. The idea is if you can get 25 people to show up, we can work with you on scheduling an event, and we can handle all the logistics and the like. And in some cases, if we get a couple of different organizations, say in Farmington, asking for an event, we may combine them. But broadly speaking, the idea here is twofold. At this stage, there are two primary barriers for getting folks vaccinated, according to the research. One is if folks feel like they don't have enough information, and that's why we continue to do town halls and other opportunities for folks to ask their questions. And the other is just making it really easy for folks to get vaccinated. So bringing it to them where they work, where they go to church, et cetera. And so we're going to be doing a lot more of that. And we really want to hear from folks who want that service so we can work with them and support them.
Very good. And I have a question about doctors' offices providing. So are we at a point yet where local physicians now have them available in their office to administer then?
Well, we've always had some physicians enrolled in our as COVID-19 vaccine providers, and we're encouraging more to sign up, in part because we recognize that at this stage, doctors, primary care physicians, are often the most trusted messengers in people's lives when it comes to health information. And so it works really well if somebody shows up for a visit to look at their cholesterol, and the doctor also has a conversation with the patient about encouraging COVID-19 vaccination, answers questions in the privacy of their office, and then does the shot right then and there if the patient's willing. There are some obstacles, which is some primary care physicians don't have the freezers or really don't have the infrastructure to do vaccinations, which is why some of them don't, and it's why they're not pharmacists. But some could, and some could convert into doing more of that kind of thing. So those that could, we want to work with them, support them as well. We're going to have a whole messaging campaign for primary care physicians' offices with brochures and posters and clear materials they can offer to their patients, just to make the whole thing a lot easier for everyone involved.
Got you. Interesting. And so, Matt, as we mentioned earlier, San Juan County is ahead of the statewide average, correct, on percentage of residents who at least have one or both vaccinations, or the one shot from Johnson & Johnson, of course. And so, as a whole, that helps move the state closer to that 60% margin, but you've got counties that are maybe behind the average, and so I imagine a lot of your efforts are focused maybe on those locations to try to get them at least to come up to where the rest of the state is, or the average.
They are, yeah. It really depends. My internet just went down, so I don't have the ability to look at the actual dashboard that you're looking at the moment. But I think we take feedback in a lot of different ways. Obviously, when counties are a little bit behind the average, especially if it's affecting the red, yellow, green status, we hear from them and we strategize with them about how to raise their numbers. But even in counties where the numbers are going well, there's still pockets of opportunity. And the folks in the counties often know about those pockets of opportunity the best, mayors and city councilors and the like. So we hear from them, even in counties that are doing well, and they tell us things like, hey, this population or this community or this college is open to getting vaccinated. We just need to get doses to them and message better and reach out more fully. So we're always strategizing, I think, on all those different levels. The approach just varies from place to place.
Got you. And last question, Matt, again, to folks who were maybe part of the earlier phases of the vaccine. They were eligible, but for whatever reason, they decided against getting it. They wanted to wait a while to see how it goes. Today, I think you would agree that anyone in those phases that we talked about, 1A, B, 2, anyone over 16 or now over age 12, vaccines are available pretty readily across the state for anyone above age 12 who wants to get one. Is that true?
You got it. We have plenty of supply, and we have plenty of willing providers, and we're going to have even more providers as more primary care physicians and soon pediatricians join the ranks of vaccine providers. So, yeah, getting vaccine to folks is not a challenge. It's a question of reaching them, and in some cases, having that frank conversation about the safety and the efficacy of the vaccine. But yeah, there's nothing standing in New Mexicans' way at this point. In fact, I'd encourage everybody listening, if you haven't already, go to vaccinenm.org, register and schedule your own appointment. And if you're a parent of somebody under 18, register your children as well, and go ahead and schedule their appointments as well.
Very good. Well, Matt Bieber, thank you so much for joining us this morning.
Great to talk to both of you, as always.
Great, Matt. Thank you very much. We appreciate it. Matt Bieber from the Department of Health, again, sharing the information. So, again, we are, I think, lucky in this country that we have access to the vaccines. You only have to look at the news and see like places like India where they've got issues.
That's right.
For sure.
To say the least, yeah.
And so that's important. So there you go. Want to show some other numbers that we've seen from the county. Again, the San Juan County Office of Emergency Management. They continue to update the weekly COVID case numbers that we shared last week. As you can see, the state of New Mexico, they're in the kind of the red line. Magenta, thank you. Cases on the trending down. San Juan County in kind of the blue line at the bottom, and the Navajo Nation there in the green. It's kind of hard to see the county and the Navajo Nation numbers compared to the state. They're just a lot bigger, obviously, numbers of cases in the state level. So when we go to the next page, you can kind of see San Juan County's cases on average. And as we saw last week, we mentioned that our average was 261. Unfortunately, in the last week, it's now up to 308.
Yeah.
So we are not meeting the criteria to stay in the turquoise. Luckily, though, the new state guidelines are that we are in turquoise for the 4 weeks since last week. So it won't change next week. The next time it will change is the first Wednesday of June. But I'm concerned.
Yeah.
So
as you should be.
That we're not going to be able to stay in turquoise into June. But maybe things will change. Let's hope the next 2 weeks, because that's when they're going to pull the data to decide for that June update. But we shall see. So there's that going on. Should we go to our next guest?
I see they are waiting on the phone.
And take a break from the numbers for a moment to talk to our next guest who is on the phone. It should be, and I bet it is, Natalie Spruell from the city of Farmington. Good morning. You're on KSJE. Thanks for calling in.
Good morning, everyone. It's nice to be here, and you guessed correctly. This is absolutely Natalie.
Yes.
Kind of like radio roulette, Who's on the phone?
It's as though we didn't tell you when to call.
That's right. No, as always, Natalie is early, which is wonderful.
Which is
and
awesome.
Thank you for calling in to visit with us, because Megan and I were talking about, what's going on this summer, what's going to be available for, kids, if parents are thinking about what to do with the kids who are going to be home, and our thoughts went to the city of Farmington. And so you are here to join us, and I know things are a little fluid, right? And so you're planning as things are right now, and all this has an asterisk subject to change, right?
That's absolutely correct.
Got it. But tell us, I guess, as things stand right now, Natalie, what Parks and Rec Cultural Affairs has planned for the summer.
Well, I'll tell you, our teams all across the city have been very busy. Park usage, obviously we have 58 beautiful parks within the city of Farmington, and the grass is greening up and the trees are leafing out. So obviously our parks are a great amenity that anyone can have access to. We are taking facility reservations or park shelter reservations, so you can certainly call our park reservations number at 599-1400 to reserve a park shelter. So that program is up and running. In our aquatics division, Lake Farmington is open. We are excited to once again be ready for the summer season out there. So you can take your families out there. The beach area is open. It's not guarded this year, but there is access to the beach, and you can take your family out there, and the shade structures are up, so the lake is ready for service this summer.
Very good. Go ahead.
Oh, we're still in aquatics. The Farmington Aquatic Center is open for public swim, so check in on their website. First, before I guess we go any further, we'll talk about a lot of different divisions within our department, and the best place to go to check out, as we talked about, things will be fluid, but current updates as we evolve more and more into opening things more and more. Our website is really easy to remember. It's beactivefarmington.org, so beactivefarmington.org. And you can find all of our divisions' latest and greatest information at that website.
Very good. And as I mentioned earlier, Natalie, we're in turquoise right now, and so I imagine all of your plans are kind of based on the current turquoise status. Is that accurate?
That is correct.
Gotcha. So if things change, folks should go to that website to see how that may impact what you're talking about this morning.
That's correct.
Okay. So
you are on your A game this morning.
Well, Megan might disagree with you about that. I don't know.
I'm actually just feeding him answers from across the room.
I was going to say, that's my story, and I'm sticking right to it.
Okay. Well, I appreciate that. I'm going to loop that one so I can watch that from time to time.
Sorry, wait.
Okay.
Yeah. So I'm going to jump in here. I know that you guys are not coordinators for Connie Mack, but I remember seeing you there, so there's something to do with Parks and Rec. So do you know any update there?
So again, as everything is fluid, we are moving forward. I am going to pull up my notes here. The Connie Mack World Series Committee is planning on hosting the tournament. The easiest way to remember for me is it's a little earlier this year. It's the last 11 days of July.
Very good.
Again, plans are ever evolving with that event, but it is on the calendar. We are planning to have it, and I just have to tell you, while we're talking about that, we have an amazing park operations crew. If you haven't been by Ricketts lately in the last year or so, take a drive by there. There's a lot of activity going on. They have during COVID, it happened. Everything happens for a very great reason for scheduling. The bleachers have been extended, so we've had many upgrades to the facility. Our park operations team has laser leveled the infield, put in new sod. So they're doing a lot of things. So all of that said, put Connie Mack on your calendar, try to make it out there and see one of the most premier fields in the country.
Nice. Well, and I know that really makes an impact on those players when they arrive, because many of them have never played in a park as big and as nice as Ricketts Park is in Farmington. So for the players, it's really a treat, I know, when they get here. And Natalie, I want to just go back to aquatics for just a moment. I know, I think Bisti Bay is also hopefully on your list, and maybe around Memorial Day, is there hopefully plans to do something?
Yes, we are planning to open that under the public health order. We can do that in turquoise, so that plans are moving forward just like that. We're hoping to be ready to go by Memorial Day. And
of course, that is exciting because the slides are there, and we didn't get to play on the slides last year at all, right? So this is a new thing.
It is very much a new thing. It's kind of interesting, in our minds, Bisti Bay has been around for, quote, ever, because it's been here for 2 years. The first season, we didn't have a full season, and obviously we didn't have the slides, so this will be our first full season. We have all of our amenities in. Everything is we're staffing up and getting lifeguards ready to go, and we should have it fully open this summer for a full season. So we're extremely excited about that. Very cool. I know Scott, in particular, is excited for the lazy river component.
I'm more of a lazy river kind of guy than a slide kind of guy, I'll tell you. Yeah.
Yes. Yeah. Well, we have a little bit of something for everyone. So
there you go.
I'll do the slides.
To be lazy in the sunshine.
There you go.
If I do a slide, you got tsunami problems. That's all I'm saying.
No.
Just saying.
No, now it's kind of like We need to make an appointment to get out there and get everyone down the slide on this call.
Yes.
Okay.
See, I'm all about the
We
slides.
should totally do that.
Yes. We'll set up a splash zone for Scott.
Be careful what you wish for. That's all I'm saying.
So,
Megan?
yes, I have a question about, are there any summer camps? I mean, parents during the summer are frequently, where can I stick these children? And so,
In an educational, supportive way.
yeah, right. Well, some parents, I guess. But anyway, what is the update there? Do you guys do summer camps? What does that look like?
Our recreation division is where we house our camp program. Again, we are, right now what we have is a little bit more reduced than what we've had historically, but we are offering some camps. So this is through the Recreation Center. Summer camps are for children age 6 to 12, and registration is open now. So reach out to the Recreation Center and make sure you don't dawdle, because there are limited spaces, but 8 to 5 Monday through Friday for the week of each of the ones I'll list. There's an art camp, and that's going to run June 7th through the 11th. There's a maker camp, which is where kids will learn through hands-on activities. And a lot of fun with that one, June 21st through the 25th. And then our July camp will be a sports camp, and that's learning the basics of a bunch of sports out there. So we do have a couple camps coming up, and like I said, registration is open, and I can't stress enough to get out there and get registered, because camps do have limits.
Very good. Well, Natalie Spruell, thank you so much for joining us. You're so fun to talk to always, and we will see you on the slides.
We'll be there.
Yes, it's on my calendar.
Okay. All right.
We're committed.
There you go. Natalie, thanks so much.
Thanks again.
You're welcome. Natalie Spruell, who is the Assistant Director of Parks, Recreation, and Cultural Affairs for the City of Farmington.
So much energy. I love it.
Right?
Anytime we talk to her, it's always so fun.
Definitely.
So
Definitely.
that's who we need on the Parks and Rec side of things.
Well, yeah.
People that know how to have fun.
She's a mover and a shaker.
She is. She is.
She really is. It's true. Anyway, let's keep going, right? Share some more information. But 3 great guests right in a row. Boom, boom, boom.
Very good.
Just like that, right? We said it was going to be a great program.
All-star.
Exactly. Here's the latest numbers, everyone. Of course, 196 new cases in New Mexico yesterday. That's now a total of over 200,000, 232. 29 of those were in San Juan County. So again, that's why unfortunately our daily cases are so high. Our average is so high because of these daily cases. Yesterday, I will point out, or pardon me, day before yesterday, Tuesday, we were down to only 13 cases, and so I was hopeful, but yesterday we're back up to 29. But we're over 15,000 cases since this all began. 3 more deaths in New Mexico for a total of 4,111, and 2 of those were in San Juan County yesterday. They were more elderly patients, but still, it's still a tragedy and a loss. 472 total now in San Juan County, and we had another 146 recoveries for a total of 185,385. So we always like to share that information as well. We're tracking all this, of course, on our website at ksje.com/news. The Navajo Nation had 20 additional cases yesterday for a total of 30,662. No additional deaths, however, and so again, they hold at 1,285. A number of deaths on the Navajo Nation. And reminder that they are in status yellow. It's a different color code, of course, than New Mexico is using, but this has been effective since April 26th across the Navajo Nation. And what that means is, again, 50% maximum occupancy for most businesses, outdoor dining restaurants on the Navajo Nation at 50% maximum occupancy. And so it kind of goes into some of the details on that. Casinos are allowed to open at 50% to Navajo Nation residents, citizens, and employees only. So no visitors and tourists. Restaurants may provide indoor dining at 25% of maximum occupancy. And marinas and parks are allowed to open at 25% maximum occupancy. Again, just to Navajo Nation residents, citizens, and employees only. And there's ongoing discussions, I think, about changing that or updating that, but so far that's where they are, at yellow status. So we have a lot of companies on the watch list this week, so we wanted to share that with you. Again, just to talk about, these are the numbers of rapid responses that are going, where cases have been detected And so, again, according to the State Environment Department, if there's more than 4 rapid responses within a certain amount of time, then that business has to close down for 2 weeks. And so we haven't seen any closures recently, but we still do have a number of rapid responses, including Chanot Consulting on College Boulevard in Farmington, the Farmington Electric Utility. They both have 2 rapid responses. The Farmington Police Department had 3. Magistrate Court in Farmington had 2. Sam's Club had 3. San Juan County McGee Park had 2. Target had 2 rapid responses recently. Walmart on West Main had 2. Salt River Materials Group in Waterflow had 2. Kugler Middle School in Aztec had 2. Park Avenue Elementary in Aztec had 2. Ojo Amarillo Elementary in Fruitland had 3, as did Kirtland Middle School with 3 rapid responses as well. Bloomfield's Early Childhood Center had 2. Central Primary School in Bloomfield had 2. Country Club Elementary in Farmington had 3. Farmington High School with 2. And McKinley Elementary had 2 rapid responses. So we want to share that.
Yeah.
And I know, I believe several of the school districts have said, have moved their students back to kind of online learning as so to keep some of these cases limited and to a minimum, and so as not to impact any graduation plans that they are planning for their students. So that makes a lot of sense. The vaccination screen that we've already shared with you today, showing that 68.5% of San Juan County residents have at least 1 shot of the COVID vaccine. Fully vaccinated here in the county, 55%. And so that's another thing we wanted to share with everybody, and I'm moving to the Johns Hopkins numbers that I know you will be sharing for us,
yes,
Megan, as they come up. And so there they are. Go right ahead.
Great. So the United States confirmed cases are now at 32,816,466, and the United States confirmed deaths are now at 583,727. It was a little difficult to get through this map today because they totally changed it on
They
us.
did change it, those Johns Hopkins people.
Yeah, it looks very different. So
Right.
I'm still figuring it out.
But that's what it looks like, and again, the numbers are still there. And then we can see there's 3 now charts on the right-hand side, which are showing again the daily cases at the top in red, daily deaths in white, and then the total vaccine doses with the green line. Again, that is being shown, and so
That's new.
that is new. And I guess the daily cases is maybe the closest thing to the graph we used to show that was kind of in the yellow or orange at the bottom. The only one graph that we would show
Right.
in the old map.
And the figures on the right, it seems, are worldwide figures, or no?
Let's see. Well, I think we've selected the United States, so those should be showing the United States numbers.
Gotcha.
I'm believing.
Gotcha.
But it is new.
Okay.
It's a new map.
Yeah.
So there you go. Again, COVID testing is still happening at McGee Park. So we share that every week to remind you of that. 8 to 3 p.m. Monday through Friday, 8 to 2 on Saturdays. The curative.com is where you can register for COVID tests. But again, as we think about turquoise and staying in turquoise, that positivity rate has to be low, and we just barely made it this last time. I think we were 7.4, and we had to be 7.5 or lower. So that was close.
Right.
Yeah. So there you go. And that brings us to a close.
Yeah,
of our
except I did
program
learn
today.
something interesting.
Did
so
you?
We can
What
end
about?
with that because it relates to vaccines.
Oh, I thought it related to pool slides.
Nope.
Okay.
No pool
Didn't learn
slides.
that.
Didn't learn that. I mean, I think
Okay.
those are pretty simple. I think you just let gravity take you down.
That's what happens.
So.
True. But what'd you learn?
Obviously we know that the Pfizer and Moderna vaccines were the mRNA vaccines, and that was this groundbreaking thing that occurred, to say the least.
Right.
And I was always under the impression that it was this brand new technology that we had just warped it through super quickly, and it was, we started from nothing and produced this thing. But apparently mRNA vaccine research and refinement and all of that had been going on for 30 years.
Right. I'd heard that too.
Okay, yeah. So I share that because of this vaccine hesitancy, this idea it's brand new, we don't really know what it does. But no, there's actually been 30 years of science and testing and refining and improving and understanding that has gone on. So
Right.
it just so happened that we reached this critical mass that really what it boiled down to is more resources were allocated towards it.
Right. Very true.
So anyway,
I think
there you go.
that's a good point. And
Fascinating.
and again, as we heard from our doctors all the time, repeatedly on this program,
Get the vaccine.
if you have any questions about getting the vaccine, the person to ask would be your doctor,
Right.
your personal physician, not maybe a blog on the internet or a Facebook group or a
Not
page
Facebook.
or something.
Yeah.
And you can certainly take that into account, I suppose. But I mean, your doctor's the one that's going to know your personal health, any other health issues that you may have, and be able to tell you, what the risks are, not from the vaccine, but maybe from COVID.
Yeah.
To say, if you were to get this because you have X, Y, and Z health problems, it may not be good for you.
Right.
And so maybe you should consider seriously getting the vaccine to help you from getting sick and maybe dying if you were to get COVID, because it's still spreading, it's still here, and unfortunately it's not going away.
Right.
So I'm off my soapbox.
Yeah, thank you for that.
I'm going to go down the water slide. That's where I'm going next.
It's been a long day of soapboxing.
There you go.
Already, and it's only 9:45.
That's very true. But we are here next week, and we hope you will be too. We thank you for joining us as always, everybody, and stay well and stay safe. And we'll see you next Thursday right here on KSJE. Bye-bye.